I'm Jill Stafford, Managing Director of QTS. Thank you for looking at the opportunity to work with QTS. We're really keen to work with a number of high quality contractors in being able to deliver our vision of creating an environment to improve patient outcomes. This video has been prepared to help contractors understand how to work across our diverse estate, which includes inpatient mental health, and to keep you safe. When you're working on site, there are some key points we want you to be mindful of. We refer to our patients as service users, and privacy and dignity for them is key at all times. It's really important to treat service users as individuals, be courteous and talk to them as if you would a family member or friend. And please acknowledge and speak with them if they engage in a conversation with you. However, be prepared for any unpredictable behaviour, and if you're unsure, please speak to the ward staff. The information included in this video will help to create a safe environment for your employees, as well as those of QTS, the Trust and their service users. This will also help to ensure that your engineers are prepared when attending sites and reduce the chance of them being turned away when they get there. I hope you find the video helpful, and I will be back in a couple of minutes.
Before arriving at site, engineers must review the task that's required and identify all equipment, materials and PPE that they'll need to complete the task. Ensure the person attending is competent to fix the job first time, and consider that sometimes in this environment it takes two people to do tasks. Not all sites will have parking, so engineers need to be clear on where they can leave their van before they arrive. Ensure the correct types of materials are being used for working in the environment. As an example, these include safety screws and safety glass. If your engineers are unsure about fittings, materials or equipment required, please take both if reasonable to save duplicating visits and be able to fix tasks first time. All tools will need to be kept secure whilst engineers are on site to minimise the risk of service users being able to get hold of them. With this in mind, it's important that tools are transported in closed boxes or bags and not open tool bags or tool belts where service users could easily take tools. It's important that all engineers visiting site can account for all their tools. To be able to do this, engineers must prepare a list of all the tools they have in their box before starting work. They'll be required to review this again before they leave to ensure they still have everything they arrived with. In some sites, they may be required to complete a site tool register instead. Your engineers will be required to follow the Trust policy on dress code. This includes all engineers to wear clean and tidy uniforms, including work shoes. They mustn't wear shorts and no hats when working indoors. Engineers must not wear jewellery such as bracelets and necklaces. Any other jewellery must be kept to a minimum. If they're working inside on a ward, they must be bare below the elbows to help stop the spread of any infection. All the sites are non-smoking, and engineers must not have radios on whilst they're on site. And mobile phones are to be treated as a tool and should only be used to help engineers complete the task they're doing. When engineers arrive on site, they must firstly sign in at reception. They'll need to show identification when signing in. Whilst the engineer may have agreed a time to arrive at site, it will be necessary for them to be flexible. Depending on what's happening on the ward or in the hospital, they may be asked to wait before going through. Or they may be told that it's not currently suitable for them to visit the area they're going to. This is for the safety of all. There may be some sites where the engineers need to hand in their mobile phone to reception where it'll be stored safely. If they're wearing a lanyard, it must be anti-ligature, which means it has 3 breakpoints on it. Depending on the task, engineers may be left to work alone and will require a pass. They'll be provided with the pass once they've signed in, or depending on the site, the engineer may be required to be escorted. Once they've passed through reception, they'll be required to let the site service manager know they're on site. This is the person responsible for what's happening on the site on a day-to-day basis. On some sites, engineers will also be issued with a panic alarm and informed in what situations they may need to use this. If engineers are unsure how to use a panic alarm, they should speak to the site service manager. Many of the doors within the sites will have airlocks or are locked. This is for safety reasons, and engineers must ensure they follow the guidance of staff on site. Engineers should ensure they don't allow service users to tailgate through the doors. If engineers find service users are trying to follow them out of doors without the support of ward staff, engineers should return inside, shutting the door, and tell a member of ward staff. If the task requires them to work on a ward, they'll also be required to sign in with the ward manager and inform them of the task they're there to undertake. When the engineer is shown to the area where the task is being undertaken, they must carry out a dynamic risk assessment for the task, taking into consideration the people around them and the environment. Some key elements to consider would include being aware of blind corners or blind spots where the engineer may be working to ensure the work can be safely undertaken. Engineers must ensure they're never left alone with service users. If the work is going to be noisy, take a while, or create a lot of mess, it's important to update the ward manager with what will be happening and the length of time it'll take. Engineers must ensure that equipment or materials are never left unattended. Should they need to return to their vehicles for anything, equipment and materials must be left securely with ward staff. Whilst engineers are working on site, should a panic alarm or fire alarm be activated, they must follow the ward staff's instructions. This may include staying where they are, moving to a secure area, or evacuation. If for any reason engineers are asked to leave the site midway through a task, they must tidy up their area and quickly make it safe before leaving with their tools and equipment. On completing the task, the engineer will need to take a photo of the work for uploading to the CAFM system. The engineer should inform the ward manager and seek sign-off from the work from the relevant senior person, which will be the site service manager or ward manager. This might include completing a logbook on site if requested. If the work cannot be completed on the first visit, it's important that the engineer leaves the area in a safe condition. They must then report to the ward manager and the site services manager with an update on when they'll return to complete the work. When the task is finished, the engineers must leave the area they're working in a safe and clean state. They must not leave any materials on site and take all their rubbish with them to keep service users and staff safe, as old screws, wires, metal or glass could be dangerous if left in bins on site. The engineers must review the list of equipment they prepared before entering the site. If any equipment is missing, no matter how small, this must be reported to the ward manager immediately. Once the work has been signed off at the ward, the engineer can sign out at reception and leave their keys and panic alarm. The engineer should speak to the site services manager before leaving. Once the engineers have left the site, they can prepare a more detailed update of the work they've undertaken.
We hope that you can see the value in helping to inform you about how we need your engineers to work when on site. To help keep our service users, staff and your engineers safe on site, we need to be assured that everyone is demonstrating a duty of care for everybody else. Thanks for watching, and we look forward to hopefully working with you as one of our partners in the future.